Bismillahirrahmanirrahim ji, one of the most important primary amenorrhea question here with us right now. A 16-year-old girl is evaluated for primary amenorrhea. She's healthy and active in sports. Breast development is fully mature. Physical examination shows sparse pubic and axillary hair. Pelvic examination shows a short, bland-ended vagina. Imaging confirms absence of the uterus. Okay, we have some beautiful findings here. Which diagnosis best explain these findings? So you have 4 diagnoses and you have to tell which one is the correct answer. Number 1, Turner syndrome. Option 2, Müllerian Agenesis, Mayer-Rokitansky-Kuster-Hauser syndrome. Good luck with that name. Option C, complete androgen insensitivity syndrome. And option D, Klinefelter syndrome. Okay, so primary amenorrhea. I'm gonna tell you one thing here, just one thing, and that completely hands you the diagnosis. Whenever you see primary amenorrhea, absent uterus, and normal breast, it comes down to two diagnoses. Either it is androgen insensitivity or it is the Mayer-Rokitansky-Kuster-Hauser syndrome. Let's decode the question. You have no periods, you have normal breast development, you have a blind-ended vagina, and you have an absent uterus. Okay, these are the 4 findings. Now the next question you're going to ask to you in order to differentiate between androgen insensitivity and the Müllerian agenesis is the pubic hair normal? If the pubic hair is normal, what I'm seeing right now is sparse pubic and axillary hair. Sparse pubic axillary hair / no pubic and axillary hair means one thing, and that is androgen insensitivity syndrome. Boom, you have the diagnosis. If you see normal pubic and axillary hair, the answer completely changes, and that becomes the Mayer-Rokitansky-Kuster-Hauser syndrome. Now let's decode the every clue they are giving to us and how you're going to approach this question when it shows up on NBME or the real deal. First of all, I'm not seeing any periods here, so that means that is primary amenorrhea. They're handing you this, it is primary amenorrhea. There are a lot of other causes of secondary amenorrhea as well, but what I'm seeing right now is primary amenorrhea. Now the next thing you're going to find out is the estrogen present or no? If breasts are forming, it means the estrogen is in a good quantity. You have estrogen. The problem does not lies with estrogen. You have estrogen because the breast development is fully mature. The second important clue here is a short-ended vagina. That means there is something wrong with the Mullerian structures. And thirdly, they hand you this, the absence of uterus and cervix as well. This is another huge clue. Normally, uterus develops from the Mullerian ducts. If it's absent, you have to think of 2 things. I already told you, androgen insensitivity and the Mayer-Rokitansky-Kuster-Hauser syndrome. Now this is the money clue here. This is something that changes the diagnosis. Sparse pubic and axillary hair. This changes the whole diagnosis. Pubic hair requires androgen action. That's the pathophysiology. The pubic and axillary hair requires androgen. If the androgen is there and the receptors are not working, that means you're going to have decreased pubic hair and decreased axillary hair. And here it is mentioned that the girl is tall. AIS patients are often tall because they are not even girls, they are boys. The chromosome is XY. The last chromosome is XY because they are not females, buddies. They are males. They are fully developed males. They have their testes that produce androgens. They have their testes that produce the Mullerian hormone, anti-Mullerian hormone, which ultimately involutes the uterus. So imagine a baby has 46 XY chromosomes, he's a genetic male, and testes form because SRY gene is present, and the testes produce 2 hormones, and the AMH, which is the anti-Mullerian hormone, destroys the uterus, it destroys the fallopian tubes, it destroys the cervix, but the testosterone is present. And the male genitalia do not form because the body cannot hear testosterone. The receptors are deaf. The receptors are not working. So instead, you're going to see is the female external appearance and breast develop normally, and there is no androgen effect. Okay, so I think we have the diagnosis here. The correct answer is C, complete androgen insensitivity syndrome. This is your answer here. Now, what is the one thing that you have to remember for the steps? That is, Whenever you see the absent uterus and the present breast, the breasts are present and the uterus is absent, that comes down to two things. One is complete androgen insensitivity syndrome, and the second one is Müllerian Agenesis. Now look for just one thing which will completely hand you the diagnosis, and that is pubic and axillary hair. If the pubic and axillary hair are present, the answer is this, Mullerian Agenesis. If the pubic and axillary hair are absent, the answer is this. That is it. That completely diminishes the confusion between the Mullerian Agenesis and complete androgen insensitivity syndrome. Now let's discuss the other two options as well. Turner syndrome. Okay, so Turner syndrome is very classy, 45X. You have the short stature, you have the webbed neck, you have the streak ovaries, and there will be no breast development. So that's completely, out of the blue answer here. And what about the Klinefelter? The Klinefelter is completely, out of the blue as well. They'll never tell you it's a, girl. It's always a boy. And secondly, although he has a tall stature, but there is something that you have to remember here. It has a completely, it's small testes, gynecomastia, infertility. It's not a phenotypic female. So this is not something that's going to confuse you. What's going to confuse you here is Mullerian Agenesis and complete androgen insensitivity syndrome. So basically the high yield point here is whenever you see primary amenorrhea, whenever you see normal breast, whenever you see absent uterus, immediately think AIS or MRKH. Then look at the pubic hair. If the pubic hair is sparse, that is androgen insensitivity. And if you have the normal pubic hair, that is Mullerian Agenesis.